Thank you very much for this kind introduction. I would like to thank Professor Burguera for this invitation to have the privilege to attend this superb symposium that I enjoy learning so much. This is my disclosure. There is not, this slide probably is redundant for all the people attending the meeting. We all are convinced that obesity complications have a very important toll in the health of our population. But I would like to put this slide because the last part, apart from the obesity responsible for more than 200 diseases, is one important responsible for cancer. There are now epidemiological demonstrate that 11 different types of cancer are provoked or linked to obesity. And I always reinforce that because I feel guilty because we have not yet convinced the population, the patients, the general population about the problem of obesity and cancer. For this reason, I reinforce this message. It's clear that all these diseases connected with obesity reduce the life expectancy. The life expectancy both in men and women is reduced in 4 or 10 years just for the presence of obesity. This indicates how relevant is the point, as no one of us know what is his experience of life. It's only can be explained or demonstrated by epidemiological studies, but I think the patient know that his life expectancy is reduced could be an important force to change. Obviously, the conclusion of this introduction is that we need to treat the obesity. We agree about that. There are different treatments. Many of them are going to be addressed in this morning and the rest of the day in the symposium. I think that always our recommendation about changing weight style, lifestyle, and moving to hypocaloric diets has failed completely. If we only have these results, we cannot combat obesity. There is now the newcomers in drug therapy that are expensive. We lack long-term results, but this is going to be commented in another part of the symposium. The bariatric surgery is very effective, but is invasive. We don't know that. And I would like to put this prolonged fasting water, because many of the young people that are in the room don't remember that when I was doing the specialization training, the residency in Madrid, in Spain, we treat the obese patient with water. And it was the only treatment. And, you know, the patients normally try to escape from the hospital because they were terribly hungry and they felt sad. But the few that remain in the hospital at the long term, they became habituated to this treatment with water only. And this remembered me that in the hunger strikes, the people that make any strike have hunger, but when with a small time pass without any food, they became the ketosis, and then hunger disappeared. Then my talk will be about an equivalent to fasting, something that is similar to fasting, not equal, that is the treatment with very low-calorie ketogenic diet. But anyhow, with any treatment, we need to think that for combat obesity, we need lifelong treatments. Even if they are with drugs, we need to think that at the end, we want to follow up the patients and manage for all their life. What is the mechanism of ketogenic diet? It's very similar to fasting. The reduction in glucose, we produce a reduction in insulin levels. Not disappear the insulin, just reduction. When the insulin drops, the adipocytes start releasing free fatty acids, and these free fatty acids through the liver are transformed in ketogenic bodies. Beta-hydroxybutyrate, all that. And then this beta-hydroxybutyrate is a good nutrient. Even for the brain can supply the deficiency of glucose. But obviously, if the body is consuming ketogenic bodies, is reducing the amount of fat in the body. This is the mechanism that the very low-caloric diet are somehow similar to fasting. How we produce a very low-calorie ketogenic diet? This is the information. Just reduce the calories, less than 800 kilocalories, reduce carbohydrates, that is the reduction in calories, but with the peculiarity that it's a low-fat ketogenic diet, because ketogenic diet are different types of diets, and there is a lot of confusion. This is very low-calorie, low-fat ketogenic diet. The ketogenic time is only 3-4 months, and after that there is a treatment with low-calorie. The discussion about the confusion in the nomenclature has led to this situation. Some people, some groups in Italy are proposing that suppress very low-calorie ketogenic diet, replace that with very low-energy ketogenic therapy, and probably this name will be adopted in the future. Well, these are our own results with a group of people with obesity treated with ketogenic diet, that are the black bars, or placebo, that is clear bars. And you can see that the ketosis time takes only 3-4 months. After that, the ketosis disappears, and we enter in a treatment of low-calorie diet for several times, and after that, a normal, equilibrated diet. Then when we call this ketogenic diet, is somehow misleading, because the ketosis is present only in 3, 4, 5 months until a substantial loss of weight has been produced. What I want to reinforce of this result that we have, and we have published some time ago. In A, the first point is that the reduction in weight is very rapid. The patient knows they have reduced the weight just in 15 days has changed, because the belt has changed the point of use. And this rapid change is what produces the adherence to the treatment in long term, because the patient knows that he's doing something that is working. And it's working without hunger and without feel sad about the situation. At 6 months, this reached the toughest, that is normally, you can see here that around 6 months, this group has lost around 20 kilograms of body weight, and after in the follow-up, there is some recovery that is variable in the individual. Then the result that we have was very good. At the end, I think that this is important for the adherence to the people. And we were able to make an analysis of body composition, although there is an expert here from the clinical that is going to speak about the body composition. We measure with both pods, that is air displacement, similar to the old system when we put the patients in the swimming pool to measure density. The classic DEXA scan and bioimpedance multi-frequency analysis. We perform this analysis. You can see here in the visit C1 is before in the basal, the visit C2 is in the maximum of ketosis, and the visit C3 is the ketosis start going the reduction, and you can see that the ketosis is disappearing slowly and the body weight continues losing. But in the panel B, you can see that with this treatment and all these 4 points of measure, there is a reduction, a clear reduction in total fat mass. And there were no relevant difference between DEXA scan and bioimpedance analysis. And in the panel C, you can see here that with a system to calculate visceral body weight. That is an algorithm. This is not direct measure. The treatment of very low-calorie ketogenic diet induced a reduction, a clear reduction, also in visceral mass. When we perform the DEXA scan, you can see here in yellow the fat of the patient. You can see how progressively the fat disappears. Is reflected in reduction in body weight and the body mass index, but this is a very effective visual message for our patient to see how their own body has changed with the treatment. The problem that we have with all treatment for obesity is the long-term results. We were all able to follow the patients only for 2 years. Remember that we have ketosis only 4 months maximum, 4 or 5 months. Now we are following with hypocalcemia.